Can you get all 10 of these questions correct? Let's find out. This is Bella Academy, and we want you to pass. Which patient requires immediate attention? BP 88 over 54 and confused. Post-op patient with pain, 6 out of 10. COPD patient, oxygen sat 90% at baseline. Fever of 101 with Tylenol ordered. ABP 88 over 54 with confusion. Hypotension plus altered mental status means circulation is failing. This is always your priority. Which task can the RN safely delegate to a UAP? Assess a post-op incision, administer oral medications, ambulate a stable patient, teach insulin self-injection. C. Ambulate a stable patient. UAP can assist with activities of daily living. Assessment, medications, and teaching are always the RN's responsibility. A patient on heparin has a PTT of 118 seconds. What is the priority action? Increase the heparin rate. Hold heparin and notify the provider. Administer vitamin K. Document and reassess in 4 hours. B. Hold heparin and notify the provider. Therapeutic PTT is 60 to 100 seconds. At 118 seconds, this patient is at serious bleeding risk. Stop the drip immediately. Which patient should the nurse see first after handoff? Respiratory rate 30, restless with audible stridor. Pain 8 out of 10, requesting medication. Potassium 3.1 on telemetry. Temperature 103 with blood cultures ordered. A. Respiratory rate 30 with audible stridor. Stridor means upper airway obstruction. This is a life-threatening emergency. Airway always comes first. Before giving digoxin, which lab is most critical to check? Serum sodium, serum potassium, serum calcium, blood, urea, nitrogen. B. Serum potassium. Hypokalemia dramatically increases digoxin toxicity and can cause fatal dysrhythmias. Always check potassium before administering digoxin. A postpartum patient has a boggy uterus and saturated peripad. What is the priority intervention? Administer oxytocin. Notify the provider. Perform fundal massage. Insert a urinary catheter. C. Perform fundal massage. This is first line for uterine atony. It stimulates contraction to control hemorrhage before medications are given. A patient suddenly develops slurred speech and left-sided facial drooping. What does the nurse do first? Call the provider. Check blood glucose. Activate the stroke protocol. Obtain a 12-lead ECG. C. Activate the stroke protocol. These are classic stroke symptoms. Time is brain. Every minute equals 1.9 million neurons. Act immediately. Which IV fluid is most appropriate for hypovolemic shock? Dextrose 5 in water. 0.45% sodium chloride. Lactated Ringer's solution. Dextrose 5 in 0.45 saline. C. Lactated Ringer's. It is an isotonic crystalloid that rapidly expands intravascular volume. Hypotonic and dextrose solutions will worsen shock. Which lab result requires immediate notification of the provider? Sodium 138, potassium 6.8, hemoglobin 10.2, white blood cell count 11,000. B. Potassium 6.8. Hyperkalemia above 6.5 can cause life-threatening ventricular dysrhythmias. This is a critical value. Call immediately. A neutropenic patient develops a temperature of 100.4 degrees Fahrenheit. What is the priority action? Administer acetaminophen and monitor. Obtain blood cultures, then start IV antibiotics. Place in droplet precautions. Encourage oral fluids and rest. B. Obtain blood cultures, then start IV antibiotics. Febrile neutropenia is a medical emergency. Sepsis can be fatal within hours in an immunocompromised patient. Thank you for watching. Comment your answers below, like and subscribe to keep this channel going. We want you to pass.